NCLEX RN PDF free 2026 questions to access valuable practice resources. Question 1. Which of the following types of cardiomyopathy does not affect cardiac output? Option A, dilated. Option B, hypertrophic. Option C, restrictive. Option D, obliterative. The correct answer is option B, hypertrophic. In the early stages of hypertrophic cardiomyopathy, cardiac output is often maintained, though it may be compromised later if an obstruction develops. Question 2. Which of the following cardiac conditions does a fourth heart sound, S4, indicate? Option A, dilated aorta. Option B, normally functioning heart. Option C, decreased myocardial contractility. Option D, a failure of the ventricle to eject all blood. The correct answer is option C, decreased myocardial contractility. An S4 sound, atrial gallop, is produced when the atrium contracts against a stiff, non-compliant ventricle, often seen with decreased myocardial contractility. Question 3. Which of the following classes of drugs is widely used in the treatment of cardiomyopathy? Option A, antihypertensive. Option B, beta-adrenergic blockers. Option C, calcium channel blockers. Option D, nitrates. The correct answer is option B, beta-adrenergic blockers. Beta blockers are used to decrease heart rate and oxygen demand, allowing for better ventricular filling and reducing symptoms. Question 4. A 23-year-old client has substernal chest pain and a heart rate of 136. Breath sounds are clear. Which drug should the nurse question the client about using? Option A, barbiturates. Option B, opioids. Option C, cocaine. Option D, benzodiazepines. The correct answer is option C, cocaine. Cocaine is a potent sympathomimetic that causes rapid tachycardia, vasoconstriction, and myocardial ischemia, leading to substernal chest pain. Question 5. Which assessment finding would strongly suggest that a painless breast lump is cancerous? Option A, the evershown of the right nipple and mobile mass. Option B, non-mobile mass with irregular edges. Option C, mobile mass that is soft and easily delineated. Option D, non-palpable right axillary lymph nodes. The correct answer is option B, non-mobile mass with irregular edges. Malignant masses are typically hard, fixed to surrounding tissue, non-mobile, and have poorly defined or irregular borders. Question 6. A 35-year-old client with vaginal cancer asks about the usual treatment. Which treatment should the nurse name? Option A, surgery. Option B, chemotherapy. Option C, radiation. Option D, immunotherapy. The correct answer is option C, radiation. External beam or internal brachytherapy, radiation, is the most common primary treatment for vaginal cancer. Question 7. A biopsy report classifies a lesion as TIS, N0, M0. What does this classification mean? Option A, no evidence of primary tumor or metastasis. Option B, carcinoma in situ, no abnormal regional lymph nodes, and no distant metastasis. Option C, can't assess tumor or nodes. Option D, carcinoma in situ with ascending degrees of distant metastasis. The correct answer is option B, carcinoma in situ, no abnormal regional lymph nodes, and no distant metastasis. TIS stands for tumor in situ surface layer only, N0 means no lymph node involvement, and M0 means no distant metastasis. Question 8. When teaching a client how to care for a neck stoma after a laryngectomy, which instruction should be included? Option A, keep the stoma uncovered. Option B, keep the stoma dry. Option C, family must perform all care. Option D, keep the stoma moist. The correct answer is option D, keep the stoma moist. Maintaining moisture in the stoma is essential for wound healing and prevents the drying of secretions that can lead to airway obstruction.